22. The next study we'll look at is the PREDIMED study, published in the New England Journal of Medicine in 2018. 7,500 high-risk participants who did not have established cardiovascular disease, followed up for 4.8 years. The Mediterranean-style diet was supplemented with extra virgin olive oil, and compared to a low-fat diet, it reduced major cardiovascular events by 30%, where it was supplemented with oil, and by about 28% where it was supplemented with nuts. And this was published in the New England Journal of Medicine 2018, the PREDIMED study. One thing I like to point out is that in the 90s, we considered the best diet for heart disease to be a low-fat diet. So all the studies which were done in the 90s compared a standard American diet, which would be a high-fat, high ultra-processed food and high refined sugar diet, basically a junk diet, to a low-fat diet. And they found in multiple studies that the best study was a low-fat diet. The best diet was a low-fat diet. However, these two studies, CardioPrev and PREDIMED, showed that a healthy fat diet, not necessarily a low-fat diet, was superior to a low-fat diet. And so I would like to just point that out, because this one showed a 26 to 30% reduction. This one also showed a 30 to 28% reduction. But this was compared to a low-fat diet. If this had been compared to a standard American diet, basically a high saturated fat, high refined sugars, and high ultra-processed food diet, then the results would have been even more impressive.